Hi, everybody. It is 1 minute past the hour, and it is my great pleasure to welcome you all to this webinar entitled High Quality Peer Review, A Few Tips. I'm Mohamad Mohty from the Sorbonne University and Saint-Antoine Hospital in Paris, in France. And you're watching the International Academy for Clinical Hematology uh, around the globe and across the hematology field. This special webinar is part of a series of webinars that were launched by the IACH and dedicated to communication in medicine. And you may have already attended some previous webinars about management of social media in our daily life, how to get published. We'll have a few others, but today our focus is about the peer review process. These are my disclosures. So first, I hope everybody is convinced that the peer review process is a critical component of scientific research and publishing. And it is designed actually to validate and improve manuscripts before their public release. So the peer review process serves as a quality control mechanism, ensuring that only robust, accurate, and meaningful scientific work is being published in a reputable journal. And as you may guess, for the medical community and for medical journals, when publications can influence patient care and or inform policy decisions, the integrity of the peer review process is crucial, because by refining data interpretation through enhancing the quality of research findings, this peer review process will uphold the standards of clinical and translational research, and this will benefit both the scientific community but also the society at large. Well, the effectiveness of the peer review process relies on, at least in my personal opinion and experience, at least three fundamental, I would say, principles, which include, first of all, disclosures of conflicts of interest. This is needed to maintain transparency. This is needed, actually, you need to disclose your financial conflict of interest, professional conflict of interest, but also any personal biases that could affect the impartiality of the process. And to make it simple, if you don't like someone, if you don't like an author, you should refrain from accepting to review a manuscript authored or co-authored by this person. If you have whatever any financial interest, again, you should refrain from being involved in the review of a given manuscript. And of course, if you have whatever professional, it's from your same institution, from people you collaborated closely with, you should avoid being involved. Because disclosing these conflicts will protect the integrity of the peer review process and will help to maintain trust among authors, readers, but also, of course, the editors. The second key principle is about actually scientific expertise. So a reviewer must have the sufficient knowledge in the topic of the manuscript being reviewed, because you need to provide a useful assessment of the content of this manuscript. And this expertise will ensure that reviewers can evaluate the scientific rigor, the relevance, and the quality of the research appropriately. So in another word, you may feel very honored, very flattered if a high impact factor journal is inviting you to review a given manuscript. But again, if you don't feel you have the sufficient expertise in this topic, I would strongly recommend to avoid accepting the invitation. And of course, this is a live webinar and it's an interactive webinar. We'll have some time for Q&A at the end. So if you have any comments, any remarks, any questions about what I feel about the peer review process, I'm more than happy to address them and discuss with you at the end of the presentation. The third and very important principle of high quality peer review is about what I would call the constructive feedback. The feedback you will give when you review a paper should highlight the strengths, but also the weaknesses. But most importantly, you have to provide some actionable recommendation for improvement. A constructive feedback would allow authors to refine their work and often strengthen the study contribution to the field. In another word, it is totally useless, and you should avoid asking for something, for a change that you already know is not feasible, or asking for an impossible experiment, or trying simply to deliver a feedback which is not realistic, not feasible from what you have sensed from the manuscript, from the methods, etc., etc. Well, if you accept to follow these founding principles of the peer review process, you will have important responsibilities. It's not just the honor and the pleasure and whatever pride we may have when doing the peer review of a manuscript. The reviewing of a manuscript should be very thorough and methodical. You have to assess the entire manuscript, including a very careful scrutiny of the tables, the figures, and any supplementary data. This will require dedicated time and attention to detail. And in the absence of these criteria, actually, you may end up delivering a poor, misleading, and even maybe a useless review. A peer reviewer plays a crucial role in ensuring the credibility and the scientific value of the published work. So your primary responsibility is about actually validation of the data and the conclusions. You must meticulously examine the data and confirm that the conclusions are well drawn and well supported. You have to be able, as a reviewer, to spot incomplete or inadequate results, especially, I think, the over-interpretation of such results in the discussion section of a report. And the validation process is essential for maintaining the scientific accuracy of the published findings. So, in another word, the peer review process will involve a systemic evaluation of the data integrity, novelty, and impact. And you have to confirm that the data are presented consistently and accurately. Of course, you have to identify any gaps, any inconsistencies in data reporting. One interesting example you have to pay attention to, looking into the tables, the numbers in the tables, and the numbers in the text. The numbers in the text and the numbers appearing on the figures. All of this is important. And of course, the novelty, as I mentioned, is essential because it's about the uniqueness of the findings and the value they will add to the already available literature and the existing, of course, body of knowledge. The impact, the concept of impact, actually refers to the potential of a given study or manuscript or results to influence actually clinical practice, policy, or also drive future research. Last but not least, it is up to the reviewer to identify, actually, to ensure that the study methodology is appropriate and statistically sound. In another word, actually, you need to make sure that by reading the methods section, the reader will be able to build the same protocol and will be able, at some point, if you ensure you establish the same study, to reproduce and get the same results. So you can see data integrity and checking for consistency in data representation, novelty and impact, and the methodological soundness in order to be able to reproduce these same results or experiment. So you can have, I can provide you my personal checklist, but I think it is a very common one for manuscript reviewing. You have to pay a lot of attention, in my opinion, to the title and to the abstract, especially the clarity and the relevance of the message that are conveyed. We all well know that, unfortunately, many colleagues don't have enough time. And sometimes you have only access to the abstract of a given manuscript on PubMed and to the title. And in many cases, and I'm not blaming anybody, the colleagues will not read the full paper. So it is your responsibility as a reviewer, actually, to make sure that the most easily accessible items of a manuscript, namely the title and the abstract, are clear and they contain the most important message of the paper. The introduction, well, it provides the background, the context, the reason, the rationale why the work has been done. And of course, it is your responsibility to make sure that this introduction is sound, it is related to the subsequent sections, especially the results, but also it is your responsibility to make sure that authors are really referring to the most appropriate previous work which was used to build their current study. In another word, if you see in an introduction, the authors just referencing a couple of very generic, wide reviews to explain why they did this and this, I don't believe this is a good introduction. A good introduction would first go to the original paper to reference and be more precise, more accurate. Method and the results, I already insisted on the fact that assessing the methodology with great rigor is crucial, because the devil is always in the details. And actually, if someone needs to reproduce the study, the results, the experiment, they need to have access to the most rigorous, clear, detailed method section. I know there are plenty of limitations now in different journals about the number of words, of the size of a paper, but as far as I know, most journals would allow supplements. And in general, when it comes to the material and methods, patient and methods section, the authors are most welcome to include a maximum number of details in the supplement. But these supplements are also meant to be reviewed by you as a potential peer reviewer. So it is a very serious job that you have to take into account when you accept this difficult responsibility of actually reviewing a scientific and or a medical manuscript. Pay attention, please, to the ethical consideration. This is important, whether how the study was performed, which IRB approved it, which ethics committee, which regulatory body. The discussion actually is also an important part. It is not meant to rephrase or to rewrite the results section. And this is a common problem we see. As a reviewer, when it comes to the discussion, actually, your role is to evaluate the accuracy of the interpretation, including whether the authors acknowledge the study limitations and consider alternative explanations for their findings. As a reviewer, you should also check, because this is usually in the discussion, in the concluding remarks at the end of the discussion, you should check that the conclusions are well-founded and proportionate to the data presented. So in other words, if you have a study showing a tendency to a good survival with a given treatment, but in 10 patients from a single center. And then the conclusion is should be the standard of care. Well, I think you as a reviewer, you have to spot this and just bring it back to how you feel about it when it comes to such strong, powerful conclusion. Figures and tables are extremely important because we have also many colleagues who would mainly rely on the figures and the tables. Also, don't forget that in many oral presentations at scientific meetings and congresses, many speakers will copy and paste these figures and tables as they were published. So it is your responsibility as a reviewer to check that these visual elements are quite effective. They can stand alone, meaning that they should be understandable without needing to refer back to the full text. And I believe this is crucial. And one small example about this, you have to pay attention that there is a need for defining all the abbreviations for each table and figure, regardless whether these abbreviations were defined in the manuscript body. Because again, the figures, the tables should be able to live by themselves. And again, you have to check the accuracy, whether they are not redundant, and of course, aligned with the content. So you can see this is important. There are also some general, I would say, features. Each journal has its own set of rules, some detailed instructions to authors. There is sometimes a sort of a standardized writing and graphic features which are essential for a manuscript capacity to convey the message in an understandable, uncontroversial, and clearly visible way. And this should be, I think, evaluated clearly by you as a reviewer, actually. Well, now, what are the best practices for reviewers? Again, once you have accepted all the principles I mentioned, but also the structured way for performing a peer review. Actually, professionalism and respectfulness are essential characteristics or traits in a reviewer. High-quality reviews require that the reviewer maintain a clear and a very constructive tone, clear feedback. Remember, I insisted a lot on the constructive, realistic, feasible suggestions for revisions, for improvement. Remember, your goal is not to ask the authors to rerun the full protocol that they were performing on a multi-center basis for the last 5 years in 50 different centers worldwide. So you need really to keep in mind these parameters. Also, I think timeliness is crucial. And this implies that you have to complete the review within 10 to 14 days, in my opinion, on average. I know everybody's busy, and this is why you need to be careful not accepting all requests for review. Well, if you start saying yes to everybody and every invitation every day, every week, then you may end up in 3 weeks having 5 papers to review on your desk. And of course, this is not feasible. So you have to establish your own rules, how much I can do, because it is a sign of respect to the authors. And you also, as an author, you would love and you would like to be treated like this. You need to be reviewed in a relatively short period of time. And of course, if there is whatever major reason, then you can communicate with the editor and explain and ask for extension. And then usually the editors will inform the authors about the fact that there may be some delay. The suggestion for improvement, as I highlighted, they should be practical, feasible, realistic, aiming to enhance the manuscript presentation, the methodological rigor, and the interpretation, clarity of the results. You can offer advice on data visualization. You may suggest a different figure or a different scale, a different color, and the clarity of the argument, the feedback you're providing will be always, in my opinion, appreciated by the authors. Last but not least, I would kindly also ask the reviewers, the potential reviewers, to pay attention to the accuracy in referencing. Because again, at the end of the day, once it is published, actually, although you are anonymous, it is part of your responsibility to have put in the cloud and in the scientific literature something that is actually maybe not accurate. Now, well, I know all over the place people are complaining about the publication process, the peer review process. And I don't want to today, that's not the topic for today, enter into whether reviewers should be compensated or not. There are plenty of discussions, and maybe I'm not the most skilled person to debate this. But when it comes to benefits of peer review, actually, there are both individual but also society benefits. Actually, when you accept to be a reviewer, you have automatically access to some novel data, novel results, an unpublished protocol. So automatically you're exposed to emerging research, and that would allow your growth. I believe the peer review task and mission is part of our education, should be part of our education and training as hematologists. This is part of the professional development, I would say. Also, when you participate into a peer review process, actually, you can get insight about the editorial process, it will enhance actually your skills, in my opinion, in critical evaluation, but also in scientific writing. Actually, the more you read, the more you review papers, the more you will learn how to yourself get published and write an impactful paper. From a society point of view, actually, there is a huge benefit, because the peer review process will ensure the high quality, the evidence-based finding of the manuscript, and that will promote integrity and credibility of the scientific literature. And in medicine, in our field, published research can critically influence our clinical decisions and impact on patient care. So you have to take this into attention. However, I must acknowledge that despite its importance, today, I would say we're facing a sort of a crisis, because the peer review process is facing several challenges that we need to address, actually, if we want to maintain and enhance the effectiveness of the process. We have to work, and there is no single solution for this, on how to recognize the work, the time spent on peer reviewing. We have to create incentives for reviewers, because peer review is a time-intensive task if you really want to do it well, but it often goes unrecognized. So we have to think about the reward for a high-quality review. It's not only a financial issue, although I know some big reputable journals are offering or can offer a small amount of money to thank the reviewers for the time, especially if doing this urgently within 24, 48 hours, 72 hours. But there are different ways of recognizing the work of reviewers. For instance, acknowledgement in the journal, being published in the journal as these are the reviewers of the year, etc. Getting credit for CME, continuous medical education, and this is important for many of us. And these incentives will allow, in my opinion, to encourage greater participation, but also higher quality reviews. More and more, because there is an explosion in the number of published articles in the scientific literature, the issues of integrity and bias are becoming more and more a matter of concern. Because ensuring an unbiased evaluation is not an easy task. It's always challenging. Because reviewers can be influenced by factors such as the prestigious author institution, the established reputation, pedigree in the clinical and academic world. So strategies to mitigate such bias are needed. They can include training, but also a completely blinded review process can help to minimize this kind of risk and maintain the review process integrity. Can we be trained to be a good peer reviewer? Well, actually, I think I mentioned that when you perform peer review for manuscript, you learn a lot, and it helps you write your own manuscript. But also, training on scientific and medical writing is also an essential part where it can help you learn how to perform an efficient and effective peer review. And I must confess, it is always frustrating to see that in our universities in general, it may not be true everywhere, but in general, there is little focus on these aspects of scientific medical publication processes, rules, but also education on the peer review process, which is a crucial process, which is a fundamental parameter for dissemination of sound and science and medicine with integrity. So, in conclusion, I hope I have convinced you that high quality peer review is fundamental to the advancement of scientific and medical knowledge. And by adhering to rigorous standards, providing constructive feedback, and maintaining professionalism, the reviewers will contribute to a process that safeguards actually the credibility of research, whether clinical research, translational, or basic research. So I hope I managed to give you an overview about the principles, the responsibilities, and the best practices that are essential to the peer review process. And I guess as the scientific landscape will continue to evolve, I think it is our responsibility to foster a culture of excellence in peer review. And this should be a priority. And the integrity of clinical and translational research relies on a commitment to thorough, unbiased, and respectful peer evaluation to ensure that the published literature, scientific literature, not only meets the highest standards, but also has a positive impact on science, on our practice, and on society in general. So I will stop here, and I'm more than happy to launch the discussion and discuss with all of you. And I'm quite amazed with the number of people connected tonight. I couldn't imagine that so many people would be interested in the review process. Thank you, Dr. Rua Al-Yamani, for your kind words, thanking me about the amazing webinar. Well, I tried to do my best, and all of this is based on personal experience. We have a question from Dr. Al-Nugmush. Do you think that blinding and removing the author's name to be universal rule among the journals to avoid the risk of bias? Well, this is indeed an important comment, and I alluded to this during my talk. And actually, several journals, several publishers are already applying this double-blinded process in order to minimize or avoid this risk of bias. And actually, to be honest, I don't think you will eradicate the risk of bias, because even if you blind and remove the author names and institution, actually someone who is expert in the field, by reading maybe the methods section where it is written that it was approved by the IRB of the Paris city, well, you can already guess by going into whatever the authors wrote. Our previous work showed that, and then you go to the reference of the previous work. So why I'm insisting on this, maybe blinding is a good step, but at the end of the day, it is more about the integrity and the unbiased approach of a given reviewer. And this is why one needs to start first by accepting the principles of peer review, avoiding conflict of interest. If these authors are not my friends, then even if I'm invited, I would simply avoid it because I don't want to be tempted. Because even if they are not my friend, I mean, between brackets, their work may be extremely important, and I don't want to be biased on this. So really, it's very important. We have a question whether I can recommend any reference to improve peer review skills. Well, actually, I'm not sure. I didn't do PubMed about this, but I have some good news for you guys, because all of these communication webinars that we are now broadcasting as part of the ICH initiative for communication in medicine, each topic will be published in the form of a peer-reviewed paper in the official journal of the ICH, Clinical Hematology International. And you will see soon in a few weeks, I don't know exactly, that this topic will be published, and then you can have a paper for to read and to guide you in the process. But again, it's like surgery, it's a learning curve. You can read as many papers. It's like, if you want to learn how to swim, you can read plenty of books, of papers, but at the end of the day, you only know that you can swim when you jump into the swimming pool. So this is why I do encourage you to engage in this process and do some peer review. It can take time in the beginning. It can be very hard, but it is worth it. I have a question here from Dr. Agiemang. As a young hematologist, he or she is asking, is it advisable to apply to a journal to peer review some manuscript, or wait until you get some level of knowledge in the field? Well, there is no right or wrong answer to this. As an editor-in-chief of a couple of journals, I would receive from time to time emails from colleagues, usually young junior colleagues, telling me, oh, I would like to introduce myself, and this is my CV. And I would love to be involved in peer review. And actually, I always appreciate and like this, and we get these people involved because, as I said, you need at some point to jump into the pool if you want to know if you know how to swim. So we have also Dr. Gülderin, my friend Dr. Gülderin, Esra Gülderin from Turkey, asking, I would like to ask about reviewer language. How can reviewers provide constructive feedback in a formal, kind, and supportive tone when rejecting a paper, ensuring authors feel encouraged to improve their work without being discouraged? Well, I think you summarized it and you nailed it very nicely, Dr. Gülderin. Even if you feel the paper lacks novelty, it will have little impact on the field, or there are problems, I think it's not too complicated to adopt a very respectful tone, explaining in a polite manner, in a constructive way, why do you feel that the work is weak, maybe the statistical methods applied are not relevant, maybe you have found a discrepancy between this table and the results, or maybe you think that the paper, the work is not practice changing because the experience is limited. It needs to be validated on a multi-center in a randomized fashion. I mean, I don't believe it is very difficult to handle the peer review process, always with respect and always with great consideration to the authors. And it is important to treat other people the way you want to be treated yourself. Because if you are performing a peer review, automatically my best guess is that you're also publishing papers, because editors identify you as a potential reviewer, usually based on your reputation, seniority, but also based on your published literature. Sometimes when as an editor, if I receive a paper and I need to find reviewers, well, I simply go to PubMed and put a few keywords and see who published recently on this topic. And then I would invite some of these people to review. So we still have plenty of questions, but I think we need to stick to our usual time. I hope you have enjoyed it. Of course, I'm more than happy to answer other questions by emails. And as I mentioned, all of these communication webinars will be also drafted as a manuscript that will be published in the ICH official journal. So thank you again for your attention. Thank you for being loyal to the ICH activities. And wherever you are, please stay safe and keep well. Thank you very much, and see you soon.